Rana Sarwar.
Thank you, Presiding Officer. Can I join others in wishing Manager Steve Clarke, Captain Andy Robertson, Vice-Captain John McGinn and the entire Men's Scotland team all the very best for the Euros, and also wish the Tartan Army a safe and enjoyable visit to Germany. Presiding Officer, before I was elected, I worked in our NHS as a dentist, just one part of our NHS which is currently in crisis. And earlier this week I visited a practice in Fife, and much to their frustration, they can't take any more NHS patients. In fact, 4 out of 5 practices across the country aren't accepting new NHS patients, and more people are being forced to go and pay private. And it's not just dentistry, it's all across our health service, and the problem is growing. The number of people being forced to pay for their own care has gone up 86% since 2019 and are at the highest levels ever. Labour created our NHS to be free at the point of need. Why does that principle not apply under the SNP?
First Minister.
Sir, I recognise the challenges that exist within dental practice, but I would point out that Scotland has 57 dentists per 100,000 of the population, compared with 42 in England and 46 in Wales. So the investment that the Government has made in the National Health Service, and particularly in dentistry, is an important contribution to establishing that position and to achieving that position. And it wouldn't have happened had the Government not given that priority since we came to office in 2007. Now, the Government has, of course, undertaken a significant intervention through the introduction of a root and branch reform of the NHS dental payment system in November of last year, and obviously we're in the early days of the implementation of that reform package. So by a combination of the investment in the workforce and the investment in that reform package, the Government is supporting dentistry within Scotland to achieve the necessary delivery of service to people around the country.